You're about to experience Healthline, a show where doctors from 𝗏𝗏𝗵𝗏 interact with you for a healthy, uplifting lifestyle. Moderated by Nicole Jacinto. You've got questions, we've got answers. So welcome to Healthline.
Hi, everybody, and welcome to Healthline with 𝗏𝗏𝗵𝗏. I'm your host, Nicole Jacinto. I don't often wear makeup. I don't often dress to the nines, but I'm your go-to gal when you have questions that have to do with health and medical topics, especially when it's accurate and updated information. You see here on Healthline with 𝗏𝗏𝗵𝗏, we interview doctors from Makati, the prestigious Makati Medical Center in Makati, Philippines, and we're coming at you live right now. It's Monday, June 26th. It's about 5 p.m. or a little past 5 p.m. and we'll be with you till 6:30 p.m. So stay tuned. And if you've got questions, we've definitely got answers straight from the horse's mouth, so to speak, straight from the doctors who we are interviewing as our subject matter experts. Today, we have with us Dr. Christine Carandan-Chacon. Welcome to the show, Doctor.
Hi. Good afternoon.
Good afternoon. Okay, so Dr. Chacon is a neurology specialist, and today's topic is acute stroke. So, Doctor, why don't we jump right into it? And can you tell us all what an acute stroke is? I mean, what exactly happens as an acute stroke, and how does it differ from other types of strokes?
Okay. So, actually, stroke in the broad sense, meaning there's a vascular problem, meaning there's an interruption of the blood flows of blood vessels, no? So it's a vascular. There are usually two kinds of stroke, no? We have the hemorrhagic kind and the ischemic kind. The ischemic kind is where there's actually yung tinatawag natin nagbabara, no? That's the ischemic kind. And then the hemorrhagic kind is yun yung nagdudugo, no? Usually, pinaka-usual cause is high blood pressure. So, usually, mga signs kasi ng stroke, it's the most common would be, we have the acronym, no? Be fast. So, it's for balance. So, usually, nag-i-imbalance yung patients. Or pwedeng eyes. So, doubling of vision, no? Makikita nyo parang doodling yung patient. And then F is for face, yung nangiwi yung mukha, so there's facial asymmetry, no? One side of the face would be parang would be lopsided, parang siya, hindi pantay. And then A is for arms, pwedeng mahina yung one side, isang arm compared to the other. And then S is for speech, yung nagbubulol, no? And then T is for time, because we have what we call a window, the golden period, no? The golden hour. It's until 3 to 4.5 hours, no? So that's when we can give primary intervention for the stroke, no?
The best care possible for it, in other words, as you said, primary intervention. Can we circle back to that topic a little bit later when it comes to the golden hour, or the time that you said, no? So just to recap what you said, Doctor, there are two types of strokes. And when a stroke happens, it's when there's a vascular problem, so meaning with our arteries or veins. And it's usually one is hemorrhagic, and that means it's bleeding. It's bleeding out. Yeah. Okay. And then the ischemic stroke is when there's, I guess, a blockage. So as you said, yung isa parang nagdudugo, na may leak, no? Yung isa naman, may bara, no? Okay, so may blockage. And
I specify na it's in the stroke. Stroke is specific for the brain. Okay. Kasi there are arteries, veins in the other parts of the body, but when you say stroke, the brain na affected.
Yes. Thank you, Doctor, for clearing that up, because a lot of people do think if you say stroke, it includes the heart. You know, they mix up myocardial infarctions or heart attacks with strokes. Of course, as you said, we have veins and arteries all running all over our body, but the stroke specifically deals with the organ of the brain. Okay, so whenever we say stroke, we're referring to the brain. And okay, so we'll circle back to the be fast later. Okay, so doctor, thank you for explaining that to us. When we say an acute stroke as opposed to a stroke, we don't usually say, okay, like let's talk about what you said, ischemic stroke. It means that something is clogged. How come? What are TIAs? What are TIAs? Because we hear that a lot. Okay.
Okay. Basically, TIAs, meron kang stroke symptoms,
Mhm.
but when you look at the MRI or sa MRI, no, wala tayong makita. Or
Oh.
sometimes symptoms would resolve spontaneously. Let's say, yung iba would say after 1 hour, yung iba naman after 24 hours. That's transient ischemic attack. So in the broad sense, para siyang one step lower lang from an actual stroke. Parang ganun.
Okay. Thank you, doctor, for clearing that up because, some people will say, I had mini strokes. Is that what you consider a TIA? If the layman's term for non-professional medicals like myself and others who are viewing the show, if they say you had mini strokes, are those considered TIAs? Are they most likely referring to TIAs?
Okay. Academically, we don't say talaga like, we don't equate TIAs with small strokes na ganun, no? Kasi technically in the MRI, when you look at the MRI, pag kami nakita kong mga maliliit na so pwede siyang mga mild silent na ischemic process.
Okay.
But then TIA is wala kang actual na overt na stroke. So hard to say na talagang ma-equate sila na they're one and the same. For man's purposes, I guess that's usually what they mean, no? Parang I think that's what they would want to convey when they say that.
That's what they would want to convey, either doctors or radiologists or whoever the medical professional is. Let's differentiate when they say a TIA. As you said, usually you get the symptoms, but when you take the MRI, by the way, an MRI is a procedure where you take you basically get a picture of the brain, right, doctor? Please jump in anytime and correct me if I'm wrong and add more information. And I understand you have a new MRI machine in Makati Med that takes
Yes. Usually the MRI, it's magnetic, no? So contrary to the perception of others, hindi siya yung wala siyang radiation, no? That's the difference yes from the scan. That's why it's safe sa mga buntis, ganyan. Yun nga lang, hindi mo siya pwedeng gawin if you have like bakal, yung mga post-procedure, mga ganyan, no? Or sa mga pacemaker, depende sa pacemaker, ganyan. And then, MRI, we do have a new one, and it's really very good tool na and especially if you're considering a very early stroke, meaning a stroke na nangyari siya within the first few minutes, no? Kasi in the CT scan, you won't see that right away. It would take hours for the CT scan to actually detect an ischemic kind of stroke. But the hemorrhagic, makikita agad yun, no?
Okay.
But in the MRI, as early as iba would say first 5 minutes or first 30 minutes of the symptoms, makikita mo na siya sa MRI, no? But usually sa MRI, nasa enclosed space ka kasi. That's why other people have difficulty tolerating mag-undergo ng MRI. That's why some would prefer CT scan.
Yes. Thank you, doctor, for clearing that up for us. So with an MRI, it's magnetic resonance, what's the I? Imaging. Okay, imaging. Okay. Okay, so as you said, I'm so glad you made it clear that there's no radiation with that. And that's the first go-to tool, and it's safe for women who are pregnant. The only probably contraindication or like if you wouldn't take an MRI is if you have steel implements in your body or a pacemaker that it might affect. But of course, once you're in the hospital and doing that, yes, you will obviously assess the patient. And I always remind patients and viewers that you should be very honest and don't forget, like I have let's say a steel bar here from my broken bone before, or patients with fractures may be referred rather to a CT scan. But as you said, the MRI is one of the fastest ways to see it, especially even while the stroke, like within minutes that it has occurred, you can see it in the MRI already. Okay, doctor.
Yeah.
So, and all right. So we thank you for clearing the difference between the equipment that's used, both the MRI and the CT scan. Well, the CT scan you can use on the brain, but other parts of the body as well. Correct. And the MRI also, but that's what you use the first yes, the first line of sort of I guess diagnosing a stroke. And as you mentioned, a lot of patients get scared or agitated because the MRI, you feel claustrophobic. You can feel claustrophobic. Have you ever, do you consider, or I'm sure you've done it, how do you say this? Giving patients medication to make them calmer if you really need that MRI and they don't have any other steel implements in their body?
Kasi sometimes if we really do prefer an MRI over a CT scan, we can sedate the patient, no? So we can give some IV medications na anti-anxiety, mga benzodiazepines like that, diazepam or midazolam. We can give those naman for them to calm down and then tolerate the procedure better. But just to baka mapagalitan urologist. Talaga, in practice is the parang talaga first line kasi it's more available, and the CT scan kasi you just have to differentiate kung yung symptoms na yun would be caused by a hemorrhage or an ischemia. So yun lang, because otherwise everything can be diagnosed clinically, and then the CT scan will give you the signal to start medication such as blood thinners, if ever, or what we call the clot buster or TPA, para lang mabigay yung medication.
So the imaging is you can get an idea, or you already know as practitioners when you do the clinical part, when you interview the patient or you see the symptoms. But these two imaging techniques are used so you can tell really like scientifically, okay, here's the evidence. It's either ischemic, and as you said, that's pag may bara, when it's clogged, or it's hemorrhagic. And if it's hemorrhagic, of course, you would treat it differently. You would use maybe blood clotters as opposed to with ischemic blood thinners. Okay.
Yeah.
All right.
More or less.
More or less, sort of. Okay. Okay. Thank you, doctor. Please, jump in, correct me if I'm wrong anytime, or if you'd like to add anything. You are the expert, and I am simply helping you deliver the message to all of our viewers, our listeners on DZRJ 810 AM Radio Bandido, and to those who are also watching the show live, and to those who are streaming it or watching it at other times. More available now on Facebook and YouTube, and also the Makati Med website, I understand. So that way, you can watch the show over and over again, and like really get all this information from doctors like yourself who are experts at these matters. And doctor, okay, so we were talking about strokes in general. Thank you for defining that for us. That's a big thing. Why is, or some strokes, okay, when do you call it an acute stroke? What is acute stroke? Okay.
Acute.
Oh, okay. Well, we'll wait for the doctor to get back online in just a couple of minutes, probably, or maybe even less than a minute. As we've moved on from COVID, we do a lot of shows that are live, but we do use technology. It's more convenient, safer, and we can get information to you faster and better. Hi, doctor, you're back. Okay, so thanks for getting back so fast. Okay, so when we say acute stroke, doctor, what exactly does that mean? Doctor, you may be muted. Could you unmute? Doctor, are you muted?
Sorry. Okay, there.
Sure. Okay, great.
Yeah, okay. Can you hear me now? All
yes,
right,
absolutely.
Okay, so kasi, the stroke kasi, we define it also based on when it occurred, no? So from the time of the symptom onset, no?
Okay.
So if it's for the first 3 hours, so the first 6 hours, it's what we call hyperacute stroke. But then for the first 72 hours, no, that's the acute stage.
Okay.
Then after that, no, after the 72-hour mark, that's already the subacute. Then maybe after 2 weeks, then that's the chronic phase already. No?
Okay.
So yun lang naman yung distinctions. Kasi, of course, depending on how, kasi it would indicate goals kapag depende sa timing from onset of the symptom.
Okay. Thank you, doctor. So basically it's a way of, if I'm understanding it correctly, I'll just try to recap what you said in my own words. The system for classifying it as whether it's acute, hyperacute, subacute, or chronic is the hours that you recognize the stroke and are able to diagnose it. So within the first 6 hours, that's a hyperacute stroke, because maybe things are still happening. I don't know. Like, first when you say acute, it means parang immediate emergency right now. No, that's my understanding as a layperson not in the medical field. And 72 hours, within 72 hours, that's what, 3 days or something like that. That's oh my gosh, I don't know my math. No, more than 3 days.
That's acute.
Okay.
Sure.
Okay.
First 6 hours is hyperacute.
Okay.
First 72 hours is acute.
Acute.
After that, that's subacute. And then after two weeks, that's chronic already.
Chronic. Okay, so great. Thanks for defining, for giving us all those definitions, doctor, because sometimes, we'll hear, oh, I had a stroke, and then we'll hear, I had an acute stroke. And then, we don't know exactly what it's called. And when you say acute stroke, it sounds more serious. Or when you say, I had a hyperacute stroke, but it also has to do with how you classify it in terms of the time. So maybe we shouldn't panic as much, no? It depends, of course.
It's more of, it really entails more on the treatment goals, no? Kasi if it's hyperacute, iba yung approach, no? Or and so on and so forth.
Yes. Okay, so it helps doctors like yourself and urology specialists like yourself know how to treat what's going on exactly. Like, what stage is it in? Okay, is there scars? Are there scars? Is this okay? So thank you for that great explanation, doctor, and for that great piece of information, because we just tend to go with what we hear, and then there's already immediately an impact on us in terms of words used and classifications, and we panic as patients or loved ones of patients, or if we love the patient, even if the patient doesn't love us, that kind of thing. So okay, all right. During an acute stroke, or right after, or if you want to call it simply a stroke, what exactly happens in terms of, you can go and describe the hemorrhagic and the ischemic if you'd like. What exactly happens in the brain?
Okay. In the brain, no?
Okay.
So, stroke in general, pwedeng, what can happen, let's say, if there's a clog, if there is ischemia, it can be kasi two things. It can be thrombotic or it can be embolic. So, if it's thrombotic, meaning slowly developing siya, no? Na nagbabara siya paunti-unti yung arteries. If it's embolic, usually there's a different source of the clog, no? Pwedeng galing sa heart, pwedeng galing sa ibang arteries na may namuo na dugo, and then, like, nagtapon siya, parang ganon. That's an embolism, no? So, usually, pagka ganon, yun, ang maximal at onset, yung tinatawag natin, meaning yung symptoms, yung pinaka-worst na agad niya, no, yung 50% like that, no. And then usually kapag ka naman hemorrhagic, usually pwede siyang merong kasamang headache, kasi pagka may hemorrhage, pag may dugo, mataas ang pressure. So pag mataas yung pressure, yan, tutulog-tulog yung patient, hindi masyado gumigising, drowsy or yung iba comatose. Yung iba naman would be, yun nga, nagva-vomit, no? Or yun nga, sobrang sakit ng ulo, ganyan. That can also be true actually sa ischemic kind, but if it's really large and namamaga, there's the malignant. So medyo mas na siya. But for a layman, it would be more difficult to grasp. So just to simplify it, yung sinabi ko kaninang BFAST,
Yes.
those are symptoms of stroke in general.
In general.
Both for the ischemic kind and for the hemorrhagic kind. But clinically, if you want to more or less have an idea if this patient is having a hemorrhagic kind, more or less yun nga, may vomiting, headache, decrease ng sensorium, and pwedeng elevated na blood pressure. You know, minsan more than 180, 200, ganyan yung mga BP nila.
Okay.
Now, if it's naman the ischemic kind, usually, yun nga, hindi sila usually nagpe-present ng ganong symptoms. But they can still be applicable.
Yes. I mean, both, all the symptoms that you mentioned, meaning headaches, vomiting, sort of the loss of, parang the slurring, all of that, it can happen with both strokes, but usually they present differently. In most cases, they present differently, and that's one of the ways, or not one of the ways, but the basic ways that you can tell. I'm just tapping, doctor, and jump in and correct me anytime. So at least you're telling us it's not just okay, this one, that one. They can present in different ways, and what you have to do really is evaluate the individual. A specialist like yourself and other doctors have to evaluate the individual. And doctor, earlier when we were talking about the ischemic, you mentioned embolic or thrombotic. Thrombotic is when you can see the artery or the vein in the brain itself, like slowly it's clogging.
So
is there.
But mas progressive na process, no? Para siyang nagde-develop ng mas hindi siya yung sobrang kumbaga nangyari abruptly yung symptom tapos stepwise progression. Unlike yung sa embolic na yun na yung symptoms. Yun yung sobrang progressive talaga.
Yun yung symptoms, big event, and that's what you're gonna see. And when you say embolic, you were mentioning, there are other parts or organs of the body as well that involved. Like it can come, the bara or the clog could have come from the heart and then gone to the brain. Or like when they say things like somebody has a pulmonary embolism, that we've heard of that. It's like when there's a clot in the leg and then it suddenly goes to the lungs. But of course, we're dealing with stroke, so we'll stick to the brain. Okay. Thank you, doctor. See,
just to jump in on that, no? Usually kasi they're basically the same mechanism kasi they're both embolism, no? But it's just that yung sa leg, in terms of dun sa anatomy kasi, ang talagang direction niyang pupuntahan yung lungs.
Okay.
It's just, so, parang ganun. So, usually, if there's sa legs, hindi siya usually pumupunta sa brain. It's really more of the lung siya pumupunta. And yun nga, yung sa heart, in terms of anatomy din, talagang pwedeng pumunta rin talaga sa
brain. Usually, that's where they go because of the way our bodies are constructed and where the blood passes through and all of that after, whether it gets oxygenated in the lungs and it's going through to your arteries, or whether it's about to be released, the carbon dioxide when you exhale from your veins, ganon. So usually, when it manifests in the brain, it probably comes from the heart or something else. Pag sa leg, the way it usually goes is to the lungs. Thank you, doctor, for clearing up all of my questions. And then, by the way, if anyone would like to send in their questions, please go ahead. You know where to reach us on Facebook. And if you are listening on radio and you still like the old style of calling the station on the landline, you can do so. You guys, I know you know the numbers to contact, and you can call up and just maybe shoot a quick question or even some greetings and say hello to AJ, who will definitely answer the phone. Thank you, AJ. Okay, so doctor, with all of what you've told us so far, how do you diagnose a stroke completely? Like you mentioned clinical, you mentioned imaging, but what's the whole picture when you definitely say, okay, this person has had a stroke?
Okay, both. You need both a clinical So the symptomatology, so that's why we really interview intensively. Makulit kami pagdating sa ER, pagka na-admit, really have to get onto the nitty-gritty of things. And also, of course, the imaging, definitely.
Yes. Okay. Thank you.
We have to differentiate, what kind of stroke we have.
Yes, thank you, doctor. And I'd like to remind people out there, like, that's why they ask you so many questions, because sometimes you might forget, and so can you hear me? Can you hear me, doctor? Can you hear me?
There? Sorry. Can you hear me? There.
Yes. So it's like, when they ask you so many questions in the ER and there's someone managing your case, it's because the more answers they get from you, or yung mga kasama mo, those who accompany you, or even strangers who suddenly see someone collapse and, they help you out, they can get more information that is vital to add to the imaging that you take, to be able to tell what kind of stroke you have, and that benefits the patient because you know exactly how to treat it. The better the treatment, the better you know the situation, the better the treatment. Okay, doctor, we're just gonna have to take a short break. We'll be back in a couple of minutes. And to those of you who want to ask your questions or send your greetings, just go ahead and do so. Of course, if you're not watching the show live, maybe we'll try to greet you next week. Sometimes people send messages and they say, "Hi, I'm watching from here," or "I watched that from there." Always appreciated. Today our topic is acute stroke or strokes in general, and we are talking to Dr. Chacon. She is a neurology specialist. So we'll be right back, folks. Stay tuned. This is Healthline with Makati Med.
You're listening to DZRJ 810 AM. We'll be right back after these reminders.
Hi, this is Dr. 𝗂𝗍𝗂 from Makati Medical Center, and I'm happy to share that our world-class quality healthcare with the heart is now more accessible and affordable at Makati Med Care Access, Araneta City. What's more, Makati Med Care Access is the only single-use hemodialysis center in Araneta City. It's now easier for patients to avail of renal care services right in the heart of Cubao. We offer health screening and diagnostic procedures in this facility at affordable rates. You can get services such as mammogram, ultrasound, lab procedures, ECG, and many others. We believe that access to affordable, quality, and compassionate healthcare is a basic human right. And we at Makati Med Care Access Araneta City are doing our best to make this possible to more people. You can find us at the ground floor of Manhattan Plaza Tower 1 in Araneta Center, Cubao. We are open from Mondays to Saturdays from 7 a.m. to 5 p.m. and Sundays from 7 a.m. to 4 p.m. For inquiries, you may reach out to us at the numbers below. We look forward to serving you here at Makati Med Care Access, Araneta City. This is Dr. 𝗂𝗍𝗂 from Makati Medical Center, and I'm happy to share that our world-class quality healthcare with the heart is now more accessible and affordable through Makati Med Care Access at 𝗂𝗶𝘶𝗵𝗹𝗶. Available for outpatient care services, our 𝗂𝗶𝘶𝗵𝗹𝗶 site offers consultation and diagnostic procedures such as medical assistance, hospital admission assistance, blood pressure monitoring, laboratory tests, and X-ray, among others. This is really convenient for those residing in Makati and nearby areas who do not want to go to the hospital to have these treatments and procedures done. We believe that access to excellent quality and compassionate healthcare is a basic human right, and we at Makati Med 𝗂𝗶𝘶𝗵𝗹𝗶 are doing our best to make this possible to more people. We are open from Monday to Saturday at 8 a.m. to 5 p.m. at the third floor of 𝗛𝗶𝘁𝗵𝗹 in Makati City. For inquiries, you may reach us at these numbers. We look forward to serving you here at Makati Med Care Access 𝗛𝗶𝘁𝗵𝗹.
You're back with Healthline, keeping you healthy. Moderated by Nicole Jacinto.
Okay, welcome back to Healthline with Makati Med. Our guest for today is Dr. Christine 𝗠𝗸𝗁𝗠. She is a neurology specialist and she practices at the prestigious Makati Medical Center here in Makati City, Philippines. We're coming at you live. It's Monday, June 26, 2023. Okay, I almost forgot the year. Okay, all right. But anyway, as I said, you can keep viewing this show and you can view it repetitively to get all the answers to your questions or as much information as you want from Dr. 𝗂𝗂𝗁, who is here with us today, who has so generously shared her time and her effort to give us information and help get us educated about strokes in general and what an acute stroke is and all the classifications. Dr. 𝗂𝗂𝗁 earlier told us that if the stroke is occurring within or has occurred within a 6-hour window, that's called a hyperacute stroke. If it's within 72 hours, that's when we say acute stroke. And if it's 72 hours and above, that's a subacute stroke. But once it hits 2 weeks and more, that is a chronic stroke. So that's something you can take away at least as information from this show, because when you start putting a lot of labels on what type of stroke is, that's how doctors and specialists like Dr. 𝗂𝗂𝗁 define it, basically the time frame. Dr. 𝗂𝗂𝗁, can I ask you, how can we recognize the signs of a stroke? Or, like if I observe something or feel something, okay, if, what should I do or what should people do during an emergency stroke situation? Okay, so maybe the signs and symptoms first. Okay, whether it's ischemic or whatever you like.
Or hemorrhagic. Yeah. So usually so for the benefit of the audiences, the BFAST acronym talaga, it's really important, no? So balance, eyes, face, arms, speech, and time. It's very important because those are the first warning signs that the patient may be having a stroke, whether it's ischemic or hemorrhagic. So pwede talaga tanungin yung patient, no? Do you feel wobbly pagka maglalakad, no? Are you falling towards one side, let's say to the right or to the left? That's imbalance, no? Or pwede rin naman yung sa eyes, nagduduling, do you see double, doubling of vision, like that. So that's what, in medical terms, that's what we call diplopia, no? And then fast, the face, no? So when you see na hindi pantay yung face, there's facial asymmetry, then that's one of the telltale signs na pwede ka mag-stroke. Others would think baka may that's possible. Yeah, that's possible, no? But that's a whole other that's a whole other topic, no? But yeah. But usually the most common na difference talaga nila is kung yung kilay natataas sabay, then more or less that's a stroke kind. Kung yung dito lang sa baba, yung problem, yung hindi pantay, no? Shallow to, tapos yung parang bagsak yung isang side, then that's usually ischemic kind. If the patient cannot raise the eyebrows, kasi ibig sabihin the whole half of the face is affected, itong including yung taas, then that's usually more compatible with a Bell's palsy. But mahirap din sabihin na ganun lang siya kasi mas marami pa siyang ibang kasama din. So the doctors will ask you other things pa aside from just the face, no? Yeah. So the face, the arms, so you ask the patient na itaas yung kamay, no? Like that. Pag na bumabagsak, no? So arms forward, pag bumabagsak, this is what we call para nagpo-pronation drift. So bumabagsak ng ganyan or talagang hindi maiangat at all. then that's a sign, no, na may problem. And also, kapag yung sinasabi natin dinadrag yung leg, no?
Yes.
When the patient drags his or her leg, then that is also a sign. Or kung hindi talaga magalaw yung leg at all, lift, all ganyan, then pwede talaga nagsistroke. Then the speech, no? Pagka hindi na siya nagsasalita, or bulol-bulol yung salita, no? Ganyan. Then that's also another symptom, no? And then, of course, time, the window period, the golden period is 3 to 4.5 hours. Very important kasi yun yung pinaka-crucial na time that you have to hurry to the ER so that the patient will be given this, what we call the clot buster.
Okay. Thank you, doctor. So if I'm understanding it correctly, the BFAST, it's an acronym for all the symptoms, and it's also reminding you to act fast if you start noticing these symptoms. So the B is balance. Okay, if somebody who is walking normally, usually suddenly they're wobbly, medyo one side is off, nadadapa-dapa sila, or sometimes they'll say, parang nahihilo ako. They'll say, I feel dizzy. And so maybe that's what's causing my imbalance, or I feel like I have to sit down for a while, that kind of thing. And as you said, one of the things that you can see, if like somebody is dragging their leg and maybe having difficulty with balance, it's another limb of the body that you should look out for, or they can't move their leg at all. One of their legs, or maybe both. The F has to do with the face. Okay, the face. So, you mentioned that you could have when the eyebrows are not even, it's like one is moving, one is up, one is down, and they're not doing it on purpose because it means there's something going on.
When you ask them to move it, to raise the eyebrows, ganyan.
Okay.
Then most likely that's Bell's palsy. Kung parehong hindi umaangat, kung parehong or kung hindi umaangat yung isang side, kasi isang side is strong, then that's usually Bell's palsy because the whole half of the face.
Is the whole half of the face. Okay. Also, doctor, you mentioned Bell's palsy, and because neurologists treat that as well, right? You diagnose it. And we don't have to get into it, but we can mention that. And there are other conditions like trigeminal neuralgia. Between Bell's palsy or trigeminal neuralgia, or maybe having symptoms of you would as a neurologist, you would be able to see what's the difference, and apply all the other things, and then when it comes to that's the arms. Okay, if you ask someone to raise their arms, like raise your arms up and dance, no, just kidding, just raise your arms up and then go Thriller. No, raise your arms up, a little bit of humor to lighten the subject, because some people get stressed out. If you raise your arms up and they can't, or one arm is weaker, and as you said, there's a pronation means like when it turns in. If you tell them to raise their arms up like this with their palms up, and one starts turning in and they're not doing it on purpose, then that's also a sign. And then the speech, the S in the B fast. So if they're slurring or they're mumbling, a bit incoherent, and maybe they think they're saying something but they're saying something else, you will notice these things in a person. And the T in the B fast, you're reminding us of the time between 3 to 4.5 hours. So I have a question, doctor. Like, what if we notice this happening for about 5 minutes and the patient seems okay?
Punta na agad sa
Punta na.
Yeah.
Okay.
Ano lang naman yun, basta before the 3 to 4.5 hours.
Okay.
It's yun talaga yung yun yung time limit kasi. But before that, if it's earlier, the better.
Okay.
Earlier, the better.
The earlier, the better. Oh, because some people will say, hindi, nahilo lang naman siya ng 30 minutes, tapos pero okay na siya. But the case may be that the person had a stroke, or maybe is still having one. It's still building up if it's ischemic stroke, and so don't delay. Go to the right away. Okay.
I always tell my patients, better training than sorry.
I know.
So it's best to
I'm the running friend of the patient, doctor. Like, I'm in the emergency room now and there. I was like, no, no, don't make a big deal out of it. But sometimes it is scary. Now, of course, if the person is really healthy and then, they're drunk, well, you can't expect them to walk straight and then all that stuff. No, but of course, it's always in context of what's happening. But it doesn't mean they can't have a stroke when they're drunk.
Yeah, exactly.
Of course. So,
That's true.
okay. So anyway, you can also, if you're like completely drunk and you probably need to be, you can also black out from that. So it's best to go to the ER. It happens to be a stroke. Doctor Karandang Chacon will treat you, okay, or someone else like her. I'm not promising your treatment to them, okay. Of course, they'd have to take you to the ER of Makati Med, which I've kind of memorized my way through to over the years. Okay, so I'll just say that I have been a long-standing patient because of the doctors that I grew up with who practice there too. But it's nice to meet doctors who are younger than me. I'm better younger than me. We can talk about that, not on the air. But anyway, okay. So thank you for that information, doctor. So it's really about time, the timing also. Like, go, don't delay. A lot of people don't want to rush off and do it and be, or let's say it's a holiday. Sometimes that happens, I mean, I not made that mistake with someone once, like not exactly like, oh, we don't want to bother the doctor, our regular doctor, because it's a holiday. But go ahead, doctor. You want to say something about it?
There's always someone on duty, especially in the ER, and talagang usually strokes, they happen sa madaling araw, no? They can happen 3 o'clock in the morning. So even if it's at 3 a.m. and you recognize na it's a stroke, rush the patient right away because you don't want to miss out on the opportunity na mabigyan nung tinatawag nating clot buster because it can only be given until 4.5 hours. Beyond that, you can't get it anymore because the risk outweighs the benefit of giving the medication.
Doctor, before I ask you what exactly the clot buster is, I just remembered from years ago they had this acronym also that they called SMILE, and it was supposed to give you also a guideline to, I don't even know what it means anymore, but if you, or no, not an acronym, but maybe if someone can't smile, if you ask them to smile, is that also a sign?
That's also a sign kasi the smile would give us a picture if the patient has asymmetry ng face. So again, the face and be fast. So there's also a telltale sign na it's probably a stroke, no? Kung hindi pantay na pag isa lang yung umangat, yung isa hindi, then pwede be stroke.
And is this a stroke, or does it always affect just one part of the face or body, or can it affect both sides?
Usually, if it's just like, let's say, one stroke, usually it's one side. No, usually it's the opposite side. But there are instances that both sides of the brain can be affected. So in that case, pwedeng both, both sides ma-affect. But that's not really common. The more common presentation is one-sided weakness or numbness or one-sided focal symptoms.
Okay. So, all right. So most of the time, the more common presentation, it's one side. Of course, in unusual cases, and it can so happen that both sides are affected. And roughly, if let's say the stroke is in the left side of your brain, then your right side will be affected.
Usually, depending on the location of the
location. What fits right in the center?
In the center?
The center.
Wala siyang specific na here. Usually kasi yung supply is yung supply niya, no, yung is usually crossed like that.
Yes.
Usually, seldom the center, not really. Hindi siya yung specific lang.
All right. That's why, doctor, they say if you're right-handed, usually your left brain is the one that is the dominant. Your left brain is the dominant side of your brain, and so your dominant hand or side is the right. And for people who are left-handed, which is 9% of every population and every civilization ever, amazing, no? Am I correct? Yes. Maybe yes. I think so. I've clarified that how many times, but anyway, if your right side of the brain is more dominant, then your left side is the more dominant side when it comes to action and things, performing tasks. Okay, what if the stroke is right in the middle of the brain? Does that happen? Like right in the
It
middle?
can happen, yes, but it depends kasi always the location always matters, no?
Mhm.
So if it's kasi yung center mostly ano yan dun sa taas
Mhm.
sa supratentorial area, mostly yung center, dun yung water system
Okay.
ng brain. No, that's what we call the CSF, the ventricles. Also
Okay.
pababa, mostly ventricles yan. So commonly what we find there, kung magkakaroon man ng stroke, it's hemorrhage, no, hemorrhage. And
Alright.
there's usually in presentation niya, it depends, no, but if there's what sorry, medyo na to, mas madami ng
Alright,
information, no?
No, but you're giving us great information and you're explaining it in such a great manner. We get it. Thank you, Doc.
And usually, kapag ka ganun, there's what we call hydrocephalus, meaning kasi nagbabara yung water system, so lumalaki siya. So depende
Swelling.
doon nagkakaroon ng mga headache or imbalance or pwedeng urinary incontinence, pero yung mga ganun, or decrease in sensorium, pwedeng ganun yung mga presentation, no?
Mm-hmm. Okay. Thank you, doctor, for answering that question. Okay. All right. I can't see doctor right now. Tech team, I can't actually see the doctor, but I see that she is there. All right. Doctor, can you hear me? Okay. All right. So while we're waiting for us to just clear this up a little bit, I'm not sure if doctor is on right now. Okay. All right. Hi, Doc. Oh, okay. So doctor is still connecting. Okay. Hi, Doc.
Sorry.
Welcome back.
I
No.
always press the wrong button pagka may tumatawag.
I understand. Thank you for sharing your precious time with us then. And I understand you're treating a lot of patients. Thank you for, spreading the word, being able to make us all aware. Awareness is so important for people. And every person at some point in their life becomes a patient. When it's a fever or a cold, whatever it is, you do become a patient. So, and thank you for your patience. Okay. All right. So, doctor, you've explained to us the importance of seeking immediate medical attention when a stroke is suspected, and that's because you want to give the clot buster. Can you tell us about the clot buster? What is that? Okay.
The clot buster, it technically is what we call RTPA, recombinant tissue plasminogen activator. Kasi ano siya the beauty of the medication is ano siya talaga, nilalize niya yung clot. So talagang tinutunaw niya. That's why it's called clot buster.
Okay.
No other drug for stroke can do that talaga. This is the only primary intervention that is approved internationally. So, siya lang yung tinatawag natin talagang direct na intervention for medically, no, in terms of medication for stroke, no? Kasi otherwise, the other blood thinners that we give, like the aspirin, 𝗂𝗶𝗶 or yung mga apixaban, warfarin, like that, they're more of for secondary prevention of stroke. Not really para tunawin yung bara, no? It's really more for prevention of a new one. Ito talaga, directly niyang lulusawin yung clot dun sa nagbarang if it is the ischemic kind of stroke.
Okay. And doctor, is this a new medicine, a new technology? How long has it been around?
No, actually, it's been around since the 90s, no? So the NIDS trial that, a concern for this medication was in 1995. Actually, the medication has been existed even before, I think probably the 80s pa, ganyan, no? But then the approval for the use as na use shaft for stroke itself, mga around 90s, mga 1995, like that.
And then, of course, now that it's been about 30 years since the 90s, I guess. 30, let's not deal with math right now. No, but since then, of course, now you know that it really works. It's been tested. There have been so many studies. So this RTPA, or the clot buster, how do you, it's the only medication, it's approved internationally. Can you only get it in the hospital?
Yes,
Yeah.
basically, no, kasi it has to be given by doctors. It has, you need a CT scan at the very least, to make sure there's no hemorrhage in the brain, to contraindicate giving it. And kasi meron tayong qualifiers, so which is a whole bunch of this na indications, contraindications, which your doctor would have to check before giving it to you. That's why it's very important that you do it at the hospital, because a doctor will have this checklist asking you all these things na whether they can give it to you for sure or not. Kasi not naman all ischemic stroke na dumating within 4.5 hours would be a candidate to receive this medication. Those na may, usually may hemorrhage sa brain, ganyan, or may hemorrhage dito sa ibang parts ng body, may bleeding, mga ganon, yung mga usual causes, hindi natin siya pwedeng bigyan ng clot buster.
Because then they will bleed out more. I mean, there are many situations.
Yes, exactly.
You can have a stroke, like let's say you got into a motorcycle accident and you fell off, and then you're stumbling around and you have internal bleeding pala. You apparently have internal bleeding, but then you also get the symptoms of a stroke and you could be having it now. So that's why only doctors in hospitals can administer it, because there might be a contraindication.
Yeah.
Also, doctor, and then when the doctors in the ER and the nurses will also keep asking you, what are you taking? What medication?
Yeah, exactly.
I mean, and are you allergic? Has there ever been a history of anyone allergic to RTPA?
Actually, from my personal experience, wala naman.
Okay, all right. And you said it works, like it really takes out that clot. That clot. How do you administer it? Like, do you stick a needle directly in the brain? Is it a tablet? Is it, okay?
No, it's intravenous. So, the usual, diba, yung suero, they'll insert an IV on you, and then they give a bolus, meaning isang mabilisang bigay, yung 10% ng medication, and then the rest, the 90% of the dose na appropriate for you, will be given as an infusion. So, meaning nakahook ka doon sa medication for a period of 1 hour.
Okay, so that's great to explain that. Look, at least if this is happening to you and you're okay with, the medication can be administered to you. And of course, there are people watching you there, to see how you are. I think many people at this point, most people have already tried getting an IV. And by the way, guys, the needles are smaller now. And then they remove it. There's plastic there, they tape it. And then there's like a 𝗶𝗶 with one or two tubes, so that they don't have to keep injecting you in your veins. So, it's not, you're already having a stroke. You have to do what you can do to treat it. But it's not, maybe not as traumatic as some of us think, with all the injections and all the hookups. So as you said, the clot buster, you will give about 10% of it directly intravenously through the, is it the IVs on the hand, no?
Usually, yeah.
Okay. All right. Sometimes, do you give it in the,
as a 𝗄𝗏𝗏𝗁, dito sa may area.
Okay.
Pwede.
One of those things, and I think at that point, experiencing any needle pain is nothing compared to the rest of the pain, or exactly. Okay. So, and then they'll hook you up to a regular IV, which is mostly what, doctor? Just saline, nutrients. Okay. So that you can inject it into that formula or whatever's going around in the body, that liquid, little by little, so that then you can you can start melting that blood clot. Okay.
So the 90% you give it infusion for 1 hour infusion.
All right, doctor. Okay, so thank you for telling us how you treat an acute stroke, or a stroke basically, when you are in the hospital. Are there any recommended services and resources in the hospital for stroke patients? Something that you would recommend aside or maybe you can just re-enumerate what you've said already, just so that we have it like in our heads, the basic Okay, go
So
ahead.
usually when a patient comes in, so of course, interview everything, ganyan. So if we suspect the stroke, definitely we will do either an MRI or a CT scan. It could be either of that. And once na masabi natin na may stroke kayo, then we will give you some medications. But the other things that we can also order for would include probably a chest X-ray, because I always tell my patients, it's wanting to stroke, it's another thing why you stroked out. So we're investigating other organs also, no? So we're looking, malaki ba, enlarged ba yung heart, mga ganyan. And then, or baka naman at the same time, may incidental finding din tayo ng iba pang mga infections sa lungs like that. That can also be seen in the, the chest X-ray. But what's really important is kung may cardiomegaly, kung malaki yung heart. We could also order for some laboratories, PC, PT, PTT. Usually, ito yung mga natin, kung kamusta yung blood, no? Kung madali mag-bleed or what, kung meron tayong bleeding tendencies also. And also, we do, of course, creatinine, check for the kidneys, because problems with the kidneys can also predispose you to different diseases. And of course, in terms of medications, sometimes may limitations tayo as to the dosage, as to what medications we can give, depending on the status of the kidneys. Also applicable to the liver. That's why we also do lab tests for the liver, such as yung mga SGPT, SGOT, like that. And of course, we do liver function tests. Kasi risk factors for stroke include high cholesterol. So we have to see mataas ba cholesterol, triglycerides, like that, no? And then we also look at the status of the heart. Of course, a 12-lead ECG at the ER level, that's very important, no? We look for irregularities ng rhythm, ganyan, because especially if there's what you call atrial fibrillation, meaning yun nga, pwedeng may parang sort of arrhythmia sa heart, then that ang taas ng risk to have an embolic stroke, no? So, and then that patient would be treated with an anticoagulant. So, iba yung natin, not just an antiplatelet. So, that's technical, no? So, maybe you can go on through that later on. And then we can also do ultrasound ng arteries ng neck, no? So, that's what we call the carotid and vertebral ultrasound. And that's usually we look for baka nagbabara na dito, no? Sa malalaking blood vessels here. Kasi again, like I said, the stroke can come from other sides of the body. So the neck could be one of them. That's also it's also more common if you're Caucasian rather than Asian. So that's mas at risk.
I'm gonna ask you before we get into the list of things that you said. Is there any demographic that, usually experiences strokes compared to others? Okay.
It can really happen to everyone, basically, everyone. No, but mostly, stroke usually happens to age 45 and above. No?
Okay.
Mas common siya. Kapag lower than that, we call that stroke in the young, then we have to investigate for other causes of stroke rather than just the usual hypertension, diabetes, high cholesterol, ganyan. Baka kasi may underlying patayang disease that we have to investigate.
Okay.
But usually, sa elderly, ganyan, and usually kapag hypertensive, diabetic, and high cholesterol, yan yung mga mostly at risk talaga pagka na-stroke.
Okay, doctor. So the other things that you would recommend, hospital services, and we're, I'll try to recap it. Please jump in anytime and to correct me or add more information. The reason why they order these tests is, okay, of course, you'll do the interview, the MRI and the CT scan. The MRI and or CT scan is a given to check your brain because that's the organ affected if you're having a stroke. Medicines will be given to you to treat the stroke. And then you get a chest X-ray because you want to see what's going on in the heart. And if it's an ischemic stroke, which means there's a clog, maybe it started there. And you can tell that with a chest X-ray. You can also see the lungs in the chest X-ray. And you can see if the heart is enlarged. And if it's enlarged at that moment, of course, then you'll talk to them about their history. Did you have an enlarged heart before? When was your last chest X-ray? Are you being treated for hypertension? Oh, okay, your heart got smaller at some point, but now it's enlarged again. So these are the reasons why you need tests like that. And then labs, CBC, the complete blood count. that will tell you. Do you ask for like a spec 23? No, you just need the CBC, and because you could be.
We can do a spec 23 para in a package na siya, di ba? And the whole of it. There are other specs din, meron spec F, spec N, may iba-iba yung packages na some in terms of Makati Med, no? Na may iba-iba silang inclusions. Some are more simplified, mas trimmed down than others. Spec 23 I think is the most complete na, hindi pa talaga complete kasi may iba pang mga lab tests, pero ito na yung pinaka-intensive na list ng laboratory tests na in terms of packages.
And then you mentioned PT and PTP, and that's to tell blood clotting time, so you can see if someone also is hemorrhaging or if their blood is not
clotting time is different kasi there's a specific test talaga for bleeding time, clotting time. This is more of ano talaga, kasi in the coagulation cascade, ganyan, so technical din. No, so it's more of yung mga bleeding tendencies. Kasi if the, what we call the INR, kasama ng PT, PTP din, or elevated, then there's some medications also that are contraindicated. Or if you are being given the RTPA, if we see na yung PT, PTT is elevated, we have to stop.
You have to stop it. Okay. So those tests work in conjunction with the other treatments, the medication. I mean, it helps you assess the patient more and be able to treat them properly. It's not like, okay, here's the medicine and then, go home, call me tomorrow. No, you have to treat them as all these things are going on.
And sorry, I also have to reiterate, because this is very important. One of the first few things that they would take from you is your capillary blood glucose, yung sugar sa pinprick, because blood sugar usually we have to distinguish if this is hypoglycemia or derangement sa sugar, kung bakit kasi it's one of the most common mimickers ng stroke.
Yes,
sugar levels,
when your sugar drops, hypoglycemia, when your sugar goes down, it can mimic stroke, like you get dizzy, disoriented, you can't really walk or move your limbs. I mean, it's actually horrible to have low blood.
And once it's corrected, you're okay now.
That's great. So it's the prick on the hand. By the way, guys, it's not as painful anymore. It's more like a blade that comes out and cuts it. I remember the times it would really be a needle, and I hated that the most. Okay, that's just a little bit of sharing there from a patient. And then, of course, when you give medicines, you also do check the kidney and the kidney function, as you said. You do that through a blood test, but you also take a GFR or an EGFR, or it's not necessary.
You can use that from the creatinine.
Okay, creatinine. And then for the liver, how do you check the liver exactly? Do you from the blood only, or do you do an ultrasound as well?
Usually, kasi the first line would be we do SGPT, SGOT, so that's just through the labs, that we take. Then if we see any other symptoms such as jaundice or mga abdominal pain, ganyan, or pwedeng yung mga problems sa pagka-iba yung color ng urine, yung mga ganun, then okay, we can take further tests such as ultrasound or CT scan of the abdomen, yung mga ganun. We can do that also. But one of the first few things na pwede natin gawin for screening would be the SGPT, SGOT.
Okay, and you did mention urine. If a patient is so weak and they cannot pee, do you give them a bedpan or do you put a catheter sometimes? So
it depends, usually, kung talagang debilitated yung patient, and we have to have an accurate monitoring of the intake and the output of the patient, such as the urine output, then the catheter is very important. But it's a case-to-case basis.
Yes. Okay. Thank you, doctor. And then you also mentioned the 12 lead. So it's lead pala, not lead. 12 lead ECG. That's when they put, you put those 12 pieces of, it's like it's something that they stick to, on different parts of your body, like mostly your chest, stomach, and
because it represents different areas of the heart.
And then they put, I'm just reminding the viewers and the listeners out there that they may put something, a little bit of a lotion type, but it's very easy. It's like sticking something on, no pain, and then they hook it up to an ECG machine, and they take your the echocardiogram, because they want to see, are you having a heart attack right now? As you mentioned earlier, is there an arrhythmia, an abnormality? Is your heart stopping? And this is part of how you are treating the patient to check on everything that's going on. And finally, you did mention you could, perhaps it's a case-to-case basis, but you could ask to get an ultrasound of the carotid artery, and that's just in the neck area. And that's like really non-invasive. It's very actually simple to do, and it can help the doctor get the information they need as they're treating you. And that's just like, putting gel or something, and then they use like a like something that feels like a deodorant roller. Same thing with your heart. So you don't do 2D echocardiograms anymore unless you think it's necessary.
We do the echo. Actually, madalas din we do the echo talaga. Kasi of course, we want to know the status of the heart, how much fluids can the heart take, what medications can we give. Because, the brain and the heart, sila, very closely related. And of course, we need the information from the 2D echo. So, huwag kayo magtataka. Baka magtaka kayo, may disease. Usually we still include 2D echo pa rin.
And the 2D echo is simply like, it just feels like the ultrasound. They put some lotion on you. Sometimes it's a bit cold, and then they just put like a sort of something that feels like a deodorant roll-on. That's always how I describe it. Okay, so doctor, thank you for all of that information. I think we need to take a short break and digest all those questions, and when we come back, I would like to ask you, so people stay tuned, because when we come back, I'm going to ask doctor what are the long-term effects associated with stroke, or patients who have experienced strokes, and how do we maybe treat them or manage them. So stay tuned to Healthline with Makati Med. We have our guest, Dr. 𝗠𝗸𝗁𝗁. I'm Nicole Jacinto. We'll be right back.
You're listening to DZRJ 810 AM. We'll be right back after these reminders.
Hi, this is Dr. 𝗂𝗂 and welcome to Makati Med Wellness Center. Located at Ayala North Exchange, the Makati Med Wellness Center is a warm and comfortable state-of-the-art lifestyle center where executive checkups and services that address holistic patient care and wellness can be done. We have a skin and laser hub, diagnostic imaging, health screening, mind and wellness care, and physical medicine and rehabilitation. The Wellness Center is equipped with modern facilities and staffed with competent healthcare professionals who are committed to deliver premium, personalized, and easy access healthcare services for both adult and pediatric patients alike. This is a great place to prioritize your health and well-being without having to be at the hospital setting. We are open from Monday to Saturday at 7 a.m. to 5 p.m. at the 7th floor of Ayala North Exchange, Tower 1 in Makati City. It is also accessible from the Makati Med Hospital through a bridgeway to Ayala North Exchange. For inquiries, you may reach us at these numbers. We look forward to serving you here at Makati Med Wellness Center.
If you like listening to our stations, DZRJ 810 AM and RJFM 100.3, there's no excuse not to listen anywhere and wherever you want. Listen on your phone or computer anytime, anywhere in the world. Just download the app for free. How do you download? If you have an Android phone or tablet, go to Google Play Store. If you have an iPhone or iPad, go to Apple App Store. It's that simple. We have 3 streaming sites. Just type in TuneIn Radio or Radio Garden or Streama. That's STREEMA. Once the app is downloaded, type in and search for DZRJ. And now you can choose and enjoy DZRJ 810 AM and RJFM 100.3 anytime and anywhere. Hey, it's free.
You're back with Healthline, keeping you healthy. Moderated by Nicole Jacinto.
Yes, everybody, welcome back to Healthline with Makati Med, and our job is to help you help yourself keep healthy. And you've got questions, we've got answers. Today, our topic is acute stroke or stroke, and our special guest, for today is 𝗠𝗸𝗁𝗛𝗁, Dr. 𝗠𝗸𝗁𝗛𝗁. She is a neurology specialist who practices, of course, in Makati Medical Center. Doctor, you've explained so well to us all the things earlier that are associated with stroke, how it happens, how to treat it, why you need all the other tests, that it's, a holistic kind of thing. Can you tell us, though, doctor, what are the long-term effects associated with an acute stroke or a stroke of any kind, if for that matter?
Okay, actually, usually stroke talaga maraming complications, no? Okay, first, of course, aside from yung talagang decrease ng functionality, no? Hindi usually kailangan assisted talaga yung patients in their activities of daily living, no? But aside from those, no, depression is a very common complication because most of our patients are no longer able to do the things they're used to. And that is talaga heartbreaking, no? And also there's what we call post-stroke seizures. So sometimes kung hindi man part ng presentation ng stroke initially yung seizures, it can also still develop like later on, or pwede rin naman kasama na siya, no? So pwedeng seizures, post-stroke seizures, or post-stroke movement disorder, no? Pwede rin yung mga parang nag-Parkinson, yung mga nagte-tremors, or parang yung mga hemiplegismus, yung bigla na lang nag-flare yung mga extremities like that na hindi nila makontrol, involuntary movements like that, that can also be a complication of stroke. Now also, stroke can also cause memory problems. It's what we call vascular dementia. So second to Alzheimer's, vascular dementia is one of the most common causes of dementia. So,
is that a complication of stroke, or can it happen on its own?
Pwede siyang complication ng stroke. Pwede rin naman siya yung sa chronic process na yung mga silent na stroke sa brain na nagbabara-bara silently. That can also be cause for vascular dementia. But again, kapag may multiple strokes na yung patient, then pwedeng magkaroon ng dementia.
Okay. And all right. So can any of the effects of the stroke be reversed?
Okay. Mostly what I usually tell my patients, let's say the paralysis. Kung talagang paralyzed talaga, especially kung initially the patient hindi niya talaga magalaw at all, even the fingers. The likelihood of it going back to 100% normal, napakababa. No? So most just to set their expectations, I always tell them that I cannot reverse the symptoms.
Yes.
No? And usually rehab medicine, no, they do a fantastic job in improving these patients' lives. It's a long-term thing. Usually it takes months, can even take until years, but it can really improve the functionality of the patient. No? Kung hindi man natin ma-achieve ang 100%, 70% and 80% probably that would not be so bad, diba?
Yes.
So yun, no, those are the things, no? And then in terms of depression, we can give naman some medications. We can work in close contact with a psychiatrist to help us manage better. Kasi neurologists, we can give naman medications, but the therapy sessions, the cognitive behavioral, yung mga ganyan,
Yes.
as psychiatrists is very much trained to do that. And that would be very beneficial for the patient. In terms of the, yung dementia, Usually, pwede naman tayo mag-start ng medications to slow down the process, but not to cure the disease itself. Slow down, no? And then if it's available, although in the Philippines it's quite hard to find one, no, we can do rehab for cognitive rehab also, no?
For dementia?
So yes, cognitive rehab, we can do that, but it's hirap niyang ma-access dito sa Philippines. So,
Okay, what other countries might have it, just in case?
United States, United States for sure. European countries, they have. In Asia, I'm not sure. But
We're
best,
not sure where has it.
so I'm not sure it's Asia, but best bet would be probably Japan, Singapore. No?
Okay, thank you, doctor. So basically, I asked you if the long-term effects could be reversed. To manage expectations, of course, you never really know. So what you answer your patients is, you cannot reverse it, but you can manage it. All the things you describe are management of any long-term effects you might have. I mean, if you're talking about paralysis or other things, maybe balance, all of these things. You did mention there is a physical rehab element to this. And there's also medicines that you can give to help with this. And, I know a patient who got a stroke and she's really like, I really have to take this for life. Can I ask you that question? Does she really have to take those meds for life? Or can
Most of them actually talaga maintenance, no? Some of them you have to take for life. But meron din naman kami mga start na medications that would be good for, let's say, 6 months or a year, like that, ganyan. But it depends on the medication.
Okay. And of course, the other aspect that you mentioned is dealing with depression, which is actually something that a lot of people ignore. So you would recommend that the patient also see a psychiatrist, and that's part of the therapy or managing, the after effects and all these symptoms. And you mentioned cognitive. That's the way of that's the way psychiatrists use it. It's a certain process, where they recognize what you're dealing with, the talk therapy, the medications also for that, so that of course are in line working with a neurologist and asking them, okay, does this med work with that? Because sometimes you do need medicine to overcome something that happened to you chemically. You changed, okay, and then there are chemical changes going on in your body as well. And if you cannot walk well, you can't get the endorphins that you used to get, So as you said, the depression really does affect and really does affect patients. Sometimes maybe even more than some of the physical symptoms. Or doctor, you mentioned dementia, vascular dementia. Okay, so is vascular dementia? I think you answered it earlier, but just to reiterate, is it caused by the stroke or does it happen on its own? Is it a different disease?
Yes, it can be like just the fact that some of the arteries are actually parang nagba-block.
Yeah.
Then some of the areas of the brain would not be supplied very well. Then meron tayong disruption sa circuitry, sa mga neurotransmitters, ganyan. So that can also be a cause for the memory lapses, mga ganyan. So yes, it can be directly caused by the stroke, or it can happen something through time na yung mga konti-konti mga bara-bara like that, then that can also lead to vascular dementia.
And then, doctor, you said you can give medicine, or maybe at the onset of dementia. What medicine do you give? Is it a brain vitamin? Is it something that helps declog
Okay. In terms of dementia, kasi the most common medication that we give would be donepezil. It's a anticholinesterase inhibitor, no? Then there's also what we call, yung iba can be given ginkgo biloba, or they can also be given memantine, which is memantine is an anti-NMDA receptor inhibitor, na drug, na which is very good na also for targeting yung mga areas for cognition. So, but the first line usually is donepezil. But depending on the status of the patient, it can have also some contraindications. So it depends. So that's why it's very important you closely talk to your doctor as if it's suitable for you. If it's suitable.
Okay, thank you, doctor. And then also, there, I just want to mention this. We do not have it yet here in the Philippines, or it's very difficult. But thank you for mentioning that you can go to other countries where you can actually do rehab for dementia, no? And let's say, doctor, someone is maybe getting hard of hearing, doesn't being able to hear or getting a hearing aid also help prevent dementia?
I think that is also a factor kasi ano no brain stimulation activity, that's very important kasi the key to controlling some sort dementia is for you to always stimulate the brain, no, to make more connections, synapses, ganyan. And kasi usually we recommend nga sa mga patients na you converse sa mga learn a new language that's possible. You can do crossword puzzles like that. But those things would be very difficult if you're hard of hearing, no? So so that's, I think, the support like that.
Okay. Thank you, doctor. Thank you. So now I'm gonna force certain people to do that and get hearing aids. Okay, doctor, you're so wonderful to have. We just have a couple of greetings here. Oh, Tin and Sofia Magallanes are watching. Hi, Ma'am Nicole. Ano ba yan? Wag na yung ma'am. Hi, watching live with Ma'am Tin. Thank you very much, Tin and Sofia. Naging ma'am pa ako. Hi, Nick, watching you. Better. Hi, Nick, watching you from Hanoi. NJ, thank you, NJ. Hi, Doc and Nick. Where can I set an appointment with doctor? Very informative, and I want to take my mom and dad from Elisa Jacuson. I'm sorry, I cannot read handwriting of other people. I am sorry I mangled your last name.
Baka doctor din.
Baka doctor. Okay.
Yeah, in terms of I'm available in Makati Med also. So usually my clinic days would be on Tuesdays and Thursdays, around 10 to 12 in the morning. Yeah.
10 to 12 Tuesdays and Thursdays. Okay, so you heard that. Lisa, I'm sorry if I mangled your last name. The person who wrote it, I cannot read your handwriting, although you have beautiful handwriting. It's me, not you. It's not you, it's me. Okay, doctor, just a couple more questions. Can you tell us what are the risk factors for getting a stroke? And perhaps that will lead us to making lifestyle changes that we can. I'm guess talking about prevention now, or if you are like this, then you might be prone to it. So here's what you should do. Yeah.
Okay. So exercise, diet, very important because number one talaga, hypertension is the number one risk factor. If you have diabetes, you're also at risk. If you have high cholesterol, you're at risk. That's why you have to manage. Talagang if you're hypertensive, manage the BP levels talaga. You have to take your medications and monitor talaga properly. And then diabetes, of course, monitoring is very important, and you have to take your medications and you have to follow up with your endocrinologist regularly. And then cholesterol, you have to diet talaga, no? So iwas sa mga matataba, no? Medyo bawal mga lechon, bagnet, no?
Pagiging mataba at kumakain ng lechon. And then, doctor, sorry, go ahead.
Yeah. And then, those are the most common. I mean, I tell my patients, sige, medyo muna tayo, sacrifice, no?
Yes.
And then, then, of course, exercise is very important. It's very, very important. I've seen patients talaga na dramatically, their labs would be very, would improve dramatically because of exercise and diet, no? And of course, if you have family.
Hi, Doc. Okay, well, Doc, we'll be back in just a minute. It's just a little problem with the connection. All right, so doctor is telling us when she got cut off that exercise and diet are really important. We always hear that, but it's actually really true. And if you're a little bit overweight, then that might be a factor, in leading to other things like high cholesterol. It's a diet that you have. If it's a high fat diet, these things, and we can look them up also and ask our doctors what's the best diet for us, and exercise, probably like, cardio exercise and all of that. Okay, so watch your blood pressure, and if you have diabetes, go see an endocrinologist. Take care of all these other things before you get a stroke. And of course, the basics, what's good for you, what's bad for you, and everything in moderation, as they say. I guess that's what I can say as someone who's not a doctor, just giving some advice. I would have liked to ask, how do you get enough exercise if you can't move because you have other disabilities? But maybe that is a question for another time and another show. I would like to thank Dr. 𝗠𝗸𝗁𝗁 for being on the program with us today. And I would like to thank the people who are watching and all the viewers, those of you who are rewatching, even if it's not live. Thank you for tuning into Healthline with Makati Med. As I said, I'm your host, Nicole Jacinto. You've got questions, we've got answers. Tune in again next week, Monday 5 to 30, Monday 5 to 6:30 p.m. And we'll be live, and you can ask your questions and you'll get your answers. Thanks, folks. See you next time.
Thank you for tuning in to Healthline with expert doctors from Makati Med, giving you the chance to interact, uplifting your lifestyle. Moderated by Nicole Jacinto. Tune in again next week for your weekly dose of Healthline.